had been for a routine mammogram, and someone has the ghastly task of saying, "You've got breast cancer, and we'll make an appointment for you to come in and see one of the surgeons."
So when I was first diagnosed with chronic myeloid leukemia, it was a little bit scary, and that was my first diagnosis. Like, I was, 2 weeks after my 40th birthday, and bang. So yeah, it threw me for a loop, and I've got adult children. My kids just heard leukemia and all hell broke loose. Actually, about 3 months before that, one of my best girlfriend's daughter had passed from leukemia.
When you get diagnosed, all you're worried about really, and the people around you, is how am I going to beat this thing? We just went for the expert opinion, and the expert opinion was right. Leave it to us. You need intensive chemotherapy and intensive radiotherapy. At no time did I think, or was I made aware, well, what might be the side effects from this? What might be some alternatives? And they're certainly still troubling and challenging me now, 18 months after my diagnosis, even though the cancer has been beaten.
I had my cancer in 2010. I'm still taking medication. I still have side effects from this daily medication. So it's not just the operation, the chemotherapy and so on. It's an ongoing thing. And my brief is to be the breast cancer representative, as I'm a breast cancer statistic.
Before my lumpectomy, I said yes, I would participate in the Rollis trial. And they're little radioactive seeds, and I was reassured they do take them out. My comments are that I think they're a very good idea because they pinpoint the tumour more accurately.
About halfway through the 3 months of my intensive treatment of radiotherapy, chemotherapy happening at the same time, I was asked if I wanted to be part of a trial for pain relief. And the pain I was having was largely from the radiotherapy killing all of my skin. It was quite enjoyable, but I don't know what the outcome of the trial was.
I was asked treatment-wise what I would like to go on, and the one that they wanted me to go on was a clinical trial for Gleevec. Every single time that I couldn't tolerate TKI anymore, the next TKI, the doctor had to get written permission via snail mail from Tasmania. So we would be maybe 2 to 3 weeks without any medication at all at that stage. I just can't fathom that. I don't know why. My numbers were going through the roof. So you're always worried that you're waiting for this medication because of all the red tape, that you're gonna, die.
If I do get secondaries, they have no idea actually how to cope with those either. But if there is a trial something they are trialing, I will participate in that. It might be more effective than chemo, and therefore for people coming after me, they could go straight on to immunotherapy and would benefit from the results that the doctors have from their trial program.
We had to relocate and move to Adelaide for 3 months. So we tried to get transferred to Perth, and we tried to come back to my haematologist who had worked with Professor Tim Hughes, who was running the trial in Adelaide, and they wouldn't even let me have my temperature or blood pressure taken here. I had to fly to Adelaide every fortnight for the first 3 to 6 months. The stress, the financial pressure, the stress about having the disease, not knowing if this med's going to work, and unfortunately it's not working, so they've just doubled my dose 2 months ago, and my numbers are still climbing, so we're not too sure where we're headed at the moment, which is a little bit scary, but...
I had a lot of joint pains, I had a lot of muscle pains, and so I don't know that doctors really understand how depressing really the treatment is. You've survived, but there's still it affecting things. So we need better drugs, essentially, I think, you know, or more research into the therapies and narrow it and target it better.
You know, when you're having an operation, you're not in a position to weigh up the pros and cons of what you're about to have, but you recognize that they're trialing something that they think will be an improvement upon what they previously have always done. Research for anything is worth doing. You know, even if it comes to a dead end, it negates an option. I think life doesn't stop, and you've just got to go and get on with it as best you can.